Imagine a world where millions of people are suffering from non-communicable diseases, NCDs, and mental health issues, with no end in sight. This is the harsh reality we're facing today, and it's a ticking time bomb that threatens to devastate the health of individuals, households, and societies worldwide. But here's the alarming part. We're already halfway to 2030, and progress towards achieving the Sustainable Development Goal, SDG, Target 3.4 is woefully off track. The goal to reduce premature mortality from NCDs by 1/3 through prevention and treatment, as well as promote mental health and well-being, seems to be slipping further away. On 25th of September 2025, the United Nations General Assembly will convene for the 4th high-level meeting, HLM4. To address this crisis and set a new vision for the prevention and control of NCDs and the promotion of mental health and well-being towards 2030 and beyond. This meeting marks a unique opportunity for heads of states and government to adopt a new, ambitious and achievable political declaration that will form the core framework to accelerate global NCD prevention and control from 2025. The declaration will be built on evidence and grounded in human rights, providing a beacon of hope for the millions of people affected by NCDs and mental health conditions. However, the current state of affairs is bleak. Underinvestment in health services has created a significant equity gap in care and support for people affected by NCDs and mental health conditions. Unless urgent action is taken, the consequences will be catastrophic. The global NCD burden and the urgency of promoting mental health and well-being are no longer just a health system problem. They require a concerted effort from governments, global partners, and civil society to address the underlying social, economic, commercial, and environmental drivers of risk and inequities. And this is the part most people miss: the need for stronger whole-of-government and whole-of-society collaboration to reshape health systems, support sustainable financing mechanisms, and tackle the root causes of NCDs and mental health issues. Ahead of HLM4, the World Health Organization, WHO, is urging countries, non-governmental organizations, UN agencies, citizens, and people living with a health condition to join forces and take action to support local and global efforts to accelerate an inclusive, equitable, and quality NCD and mental health response. But here's where it gets controversial. Some argue that the current approach to addressing NCDs and mental health issues is too narrow, focusing primarily on individual-level interventions rather than addressing the broader structural and societal factors that drive these conditions. Others argue that the emphasis on sustainable financing mechanisms may prioritize the interests of wealthy nations and corporations over those of low and middle-income countries. As we move forward, it's essential to ask, what role should governments, corporations, and individuals play in addressing the NCD and mental health crisis? Should we prioritize individual-level interventions, or focus on addressing the broader structural and societal factors that drive these conditions? We invite you to share your thoughts and opinions on this critical issue. Do you think the current approach to addressing NCDs and mental health issues is sufficient? Or do we need a more radical shift in our approach? Let's spark a conversation and work together to create a healthier, more equitable world for all.